Now with any hairline advancement procedure or coronal brow lift, something that is not a risk, it's 100% guarantee, is the top of your head is going to be really, really numb afterwards. And now this is not a complication, this is part of the procedure and there's no way around it. So and the reason for that is there are sensory nerves that run up the forehead and give some sensation to this part of the head. Those get cut in the procedure. So the top of your head is going to generally just feel really weird, like a cap or like it's somebody else's head for a while, perhaps even years after the surgery. Now, there are other nerves. There's ones that from the side, there's ones from the back that grow up and take over some of that. Some of these nerves heal. So it does improve with time. Some of it does get a little bit better and better, but it will probably never be quite the same as it was before surgery. Now, these are sensory nerves. That's different from the motor nerve that actually moves the forehead that we talked about earlier. These are just sensory nerves. They don't affect any function. They don't affect your ability to do anything. It just means the top of your head feels weird for a few months afterwards. The only thing this really matters is if you curl your hair or straighten your hair or do something with a heat source, just to make sure that you're looking in a mirror so that you can actually see it while you're doing that, just to make sure you don't get the heat source too close to your scalp, because you may not feel it and you're at risk of burning yourself. Other than that, you still wash your hair, you can exercise, ponytails, braids, I mean, whatever you like to do, it doesn't really affect that. But that is a really important thing to know before surgery. That's another thing, generally once I tell patients that, they understand that, they're okay with it, but it is something that's unavoidable and does happen to everybody.